Good morning. I'm here with Marion and Premier and for our regular update. Today I'm announcing 3 new cases of COVID-19 in our province. This new cluster of cases are all males, 2 are in their 30s and 1 in his 40s. They are all essential workers employed in the same industry. This new cluster of cases is not connected to the cluster of cases announced last week. The new cases are not related to the Canadian Premier Soccer League, seasonal residents, or to the Atlantic bubble. These 3 individuals traveled to PEI on August the 5th and have been self-isolating since that time. Our office became aware of these cases yesterday, and public health nursing have completed contact tracing. These individuals will remain in self-isolation and will continue to be followed daily by public health nursing until they are cleared by my office. Anyone who traveled on Air Canada Flight 626 from Toronto to Halifax on August the 5th may have been exposed to COVID-19. People on this flight should monitor for symptoms of this virus, and if they are symptomatic, they should call 811 to be tested. The additional cases announced today brings our overall total of cases to 44 since the pandemic began. And to date, 40 of these cases have recovered, including 4 of the cases announced last week. So despite having 4 active cases of COVID-19 in the province, the risk of transmission of the virus to islanders is low. Last week, I reflected on the significant progress we have made since mid-March and noted that there is no playbook for a global pandemic caused by a virulent and tenacious virus like COVID-19. We continue to learn more about this virus each week. We will continue to live with COVID-19 until there's an effective and accessible vaccine. Like many of my colleagues across the country, I anticipate the earliest time frame for a vaccine is 2021 and possibly later. Today, I'd like to share a few thoughts on what we can expect going forward. The further reopening of our province is contingent upon low community prevalence of COVID-19. In the weeks ahead, if we experience significant community spread, more restrictive measures will be needed to protect the health of islanders. And going forward, our approach will be flexible and nimble, adjusting to the prevalence of COVID-19 in our province, always aiming to control the spread of this epidemic. Our history over the past 5 to 6 months should provide confidence in our ability to adjust and respond to issues related to COVID-19. Our first priority as a province is to support our children and educators in the successful reopening of the schools. From a public health perspective, it is vital that we do everything possible to ensure our children have a full year of in-class learning in the upcoming academic year. Public Health continues to work closely with the Department of Education and Lifelong Learning, the Public Schools Branch, Commission Scolaire de Langue Française, and private schools to plan and prepare for successful reopening of our schools. It's also essential that we successfully integrate approximately 500 international and domestic post-secondary students from outside the Atlantic Canadian bubble into their respective academic programs so they can also benefit from a full year of learning. It has been important for family and residents of those in long-term care facilities to reconnect over the last few weeks. And we're looking forward to increasing that visitation and that ability to connect. I'd like to thank long-term care workers for so many things, including the implementation of these easing of visitor restrictions in the last few weeks. The public health system will be prepared to contain outbreaks and clusters of COVID-19 with accessible testing, early detection and isolation of cases, and timely contact tracing. Testing, contact tracing, and isolation remain our first and best lines of defense to limit the spread and impact of COVID-19. The preparedness of all aspects of the health system is important as we anticipate a second wave of COVID-19 this fall. And I know each week Marion highlights some of the important work underway within Health PEI to plan and prepare to care for islanders in the event of a surge of cases of COVID-19. By early October, our plan would be to ease measures to a point that will represent a new normal until islanders have access to effective vaccine. And specifically, I hope that a new normal will be a move to larger gatherings, but still wearing masks in closed indoor public spaces, continuing to have border screening in place at all points of entry, increasing our testing capacity at our provincial lab, and increasing capacity for contact tracing across the province. We'll continue to require self-isolation for individuals traveling to PEI from other countries and outside the Atlantic bubble. We hope to allow more sport and recreational activities to be enjoyed with fewer restrictions and increased capacity in restaurants. I want to reiterate that moving to a new normal will be contingent upon having a low number of COVID-19 cases in the province with little or no community transmission. At this point, I do not foresee moving to a Canadian bubble with no requirement for self-isolation in the coming weeks. Effective immediately, the gathering limit has increased a little bit. It's now possible for 3 cohorts of 50 to gather for an event subject to an approved operational plan that addresses the need for physical distancing. There continues to be a requirement for the 3 cohorts to be separated, each with designated washrooms and controlled entrances and exits. This increase in the gathering limit allows more people to attend worship services, concerts, and sporting events, to name a few. Groups and organizations wishing to host an event with 3 cohorts of 50 people should allow at least 2 weeks lead time for the operational plan to be reviewed. Singing is also now allowed at a 6-foot distance, provided non-medical masks are worn. Again, this change will have a positive impact on worship services, choirs, music programs, and entertainers. The participants in the Canadian Premier League Island Games have all been tested twice for COVID-19 since arriving in PEI. All tests were negative. And going forward, all participants will be tested weekly, and the weekly testing is happening today. As a general update, around the world, there are almost 22 million cases of COVID-19. And in Canada, there are over 122,000 cases. In keeping with the recent trend, this week saw 63% of domestic cases in the under 39 age group. Domestically, there was a 14% decrease in cases overall, but we notice an increase in cases in certain provinces. As I mentioned earlier, we look forward to the fall with hope and anticipation. While it is my hope we can ease restrictions and take positive steps towards our new normal, every islander and visitor has an individual and collective responsibility to stick to the basics: physical distance, wear a mask when enclosed indoor spaces, keep your circle of contacts small, and practice good hand hygiene. The choices we make and our behaviors today matter to us and to others. The next few weeks are important, and we cannot let our guard down. As a province, we have moved carefully and cautiously and will continue to do so. We are all so fortunate to be in PEI. There is no place I would rather be than right here in this beautiful and caring province. So as we savor and enjoy these last weeks of summer, please be patient and please be kind. Thank you. I'll turn it over to you, Mary.
Thank you, Dr. Morrison. Good morning, everyone. The continued focus of Health PEI and the Joint Response Team is to plan and be prepared for the coming months to ensure we're ready to respond to additional cases of COVID-19. We continue with training for clinical teams and leaders that will be on the front line of providing care to patients during the pandemic. We continue to recruit additional staff to ensure we have the capacity to manage any surge in cases. Our recruitment campaign is ongoing, and we've had some success in hiring staff to date. We do have a need for more staff, and we want to make sure we can expand our services to care for people with COVID-19 and to work at our COVID-19 related services like our testing centers. Anyone who's interested in this type of work and coming to work within our services can contact via email healthpeihr@gov.pe.ca. Last week, I updated the progress we've made in completing elective surgeries that were postponed during the early phases of the pandemic. To date, 733 cases that were postponed have been completed. Our testing clinics continue to be available for anyone with symptoms of COVID-19. Yesterday, at our testing clinics, we saw 153 people in our Charlottetown clinic, 51 in Summerside, and 27 at the Borden-Carleton testing site, for a total of 231 tests. I can never say it enough, and I want to say thank you again to our CPHO leaders and Dr. Heather Morrison, as well as the Health PEI staff and physicians who work so hard every day to provide high-quality care to Islanders. They are doing this while continuing to adjust and plan for the future. To our patients across Prince Edward Island, thank you for your understanding as we adjust our processes to ensure the safety of everyone. With added precautions and physical distancing measures in place, we know some of our services look a little different. Please remember to attend your appointments, seek health care if you need it, and bring and wear a mask or face covering to help protect others. Thank you.
And I think we'll open it for questions.
Pierre Dufault, Radio-Canada.
Bonjour, Dr. Morrison. Je me demandais si vous pourriez nous donner plus de détails en français sur les 3 nouveaux cas que vous annoncez aujourd'hui. Qui sont-ils? D'où viennent-ils? Et est-ce que le risque de transmission communautaire demeure faible ou élevé selon vous?
Oui, bonjour. Oui, aujourd'hui, on annonce 3 nouveaux cas. Ils sont les 3 cas sont les hommes dans les trentaines, un qui est quarantaine. Ils travaillent dans un emploi essentiel. Il vient dehors du pays. Et puis, depuis qu'ils arrivent à l'île du Prince-Édouard, ils sont auto-isolement et sont isolés. Alors, le risque pour la population ici, les insulaires, ça demeure très bas ou faible ici.
Vous nous avez parlé aussi, Dr. Morrison, de la nouvelle normalité, ce à quoi vous espérez qu'on atteigne au mois d'octobre, peut-être. Pourriez-vous répéter un peu en français, expliquer ce que vous souhaitez atteindre comme objectif dans cette nouvelle normalité au mois d'octobre?
Oui, et puis c'est vraiment qu'est-ce que je souhaite, mais je sais que les choses peuvent changer facilement. J'espère qu'on peut voir les nombres de personnes qui peuvent aller pour les événements en plus grand nombre. J'espère qu'on peut avoir les sports et les activités qui sont avec moins de restrictions. J'espère qu'on peut avoir plus de capacité dans les restos. Mais encore, on va porter les masques. On va continuer d'avoir plus de capacité pour faire les tests, plus de capacité pour faire les contacts, de chercher les contacts, et de continuer d'avoir les gens aux points of entry, au pont et à l'aéroport et aux traversiers. Parce que c'est les mesures ensemble qui, j'espère, vont nous protéger. Mais si ça change et on a une autre vague, ça va changer rapidement.
Merci beaucoup.
Stephanie Van Kampen, CBC.
Good morning, Dr. Morrison. Wondering if you can give us any more information about these individuals. Are they Canadians? Did they travel from outside the country or from the U.S.? And what kind of line of work they're in, whether or not they're in the healthcare field?
Hi, Stephanie. So they, and I should have mentioned this earlier, they are essential workers that travel in from outside the country. They are not in the healthcare field, and they did not use public transport to get from Halifax to Charlottetown.
So did they isolate directly when they came to the island?
Yes,
and what part of the island are they located in?
So they all self-isolated directly on arrival here, and I think that's why we can really be very comfortable in talking about the risk of transmission to the population here is very low. And so I think it's really important that we share the information that we're sharing about cases and trying to respect confidentiality at the same time. So we're trying to balance both, Stephanie, and just similar to last week, we're trying to make sure we give lots of good information and that we have all the way through for our cases, and trying to maintain that confidentiality too.
Thank you very much.
Allison Jenkins, Guardian.
Yes, hello. I'm just looking to know if these new cases are temporary foreign workers.
Hi, Allison. My response will be very similar. We've identified them as essential workers, and so there's all sorts of types of essential workers, and that's really what I'll say. They all do work in the same industry, and at this point, that's what information I'll share.
Okay. Yep. And just wondering about the back-to-school situation. We've talked about post-secondary students returning. Are there any international high school students? Is there any program like that you're expecting that will run this year?
So we have been in communication, and we've identified a small number of international students in the age group of K to 12 that are sort of home stays. So they will also be going through the same kind of self-isolation and then testing regime as any other international person coming to Prince Edward Island. We've also been working with some of the private schools and identifying some international and out of Canadian bubble students for the private schools, and all part of the return to school plan.
And those numbers, are they included in the other numbers? Sorry, just to clarify.
I think I mentioned particularly the post-secondary, which is really UPI, Holland College, and Collège de Lille. But the numbers are much smaller for those other private schools and K to 12. So, but very, very small numbers there. I don't have the precise breakdown, but there may be 6 in one school, up to 12 in another.
Awesome. Thank you very much.
Louise Martin, CBC.
Hi, Dr. Morrison. I'm wondering about the easing of the measures in the fall and expanding. You mentioned the mass gatherings to 3 cohorts of 50. And so I'm just curious about the timing of doing this in the fall. Does it sort of coincide as well with a lower risk potentially of community spread with fewer people from off island here, given sort of the traditional summer tourist season will be concluded?
Hi, Louise. I think really bringing in our international students and getting children back to school, really a priority. And I think we wanted to make sure that that goes well before any really big further easing of restrictions, and but also recognizing it would be a time to try to do so before any potential second wave. So it was really more about making sure students and international students are here safely, and we're back to school for a period of a few weeks before that easing of restrictions would occur.
So you're going to kind of keep an eye on what goes on with the school and international students coming before we sort of give an official timeline on when those mass gatherings or when that will change, or kind of this return to new normal?
Yes, Louise. So we'll be watching, just like we have what's happening here, but also what's happening in the rest of the country, and we'll make adjustments accordingly.
I was just wondering if I could ask Marion Dowling a quick question about the cough and fever clinic. I know it's closing down at Eastlink Centre at the end of the month because the Islanders will be playing on their home ice starting in October. Is there any clarification, Ms. Dowling, on where that cough, fever, and clinic will be going?
Hi, Louise. Yeah, we do have some plans that are being put in place to move the cough and fever clinic. I'm able to say that it will be within the Charlottetown area, but I can't give the specific location at this point in time. There are still some plans and preparations that are underway this week and over the coming weeks, but as soon as we have those things solidified, we'll be letting everyone know when that will happen and any further instruction on how to access the clinic.
Thank you so much.
You're welcome.
I'm fine. No, I think that's it.
Okay.
Okay. Well, thank you, everybody.
Okay. Thank you.